Hello, good morning everyone. Welcome to Nickens. In this video, I am discussing about the syllabus of first semester BSc Nursing student. So, first semester we have only four subjects: nursing foundation, psychology, sociology, and anatomy and physiology. Okay. In this video, we cover the complete syllabus of each and every subject. Like first, we discuss the nursing foundation. Okay. So first exercise for nursing foundation is introduction of health and illness. Okay. So we in this exercise cover the concept of health and which factor are responsible for the health and what will you do for better health and what will we do for reduce the disease illness. Okay. So in this chapter we completely focus on the health, how I can improve the health. Okay. So yeah, second chapter will be the healthcare delivery system. In healthcare delivery system, we have to focus on the health promotion. Like, what do you do for better improvement of the health? You can do create awareness program, immunization program, blood banking program, like vaccine program. Nahi? Do you remember like pandemic situation all over the world can affect from the coronavirus, and we have to run up a lots of corona vaccine so everyone can take and reduce the effect of coronavirus and control the coronavirus. This is very critical situation that time. Okay. So health promotion is a very important topic, how you can promote the health. Okay. And then level of disease prevention. Level of disease prevention is a stepwise process according to the condition of patient. If you have a early complication of any specific disease, you have to follow the primordial prevention, like you have to do yoga exercise, like physical activities. Okay, so can prevent the disease. Like level of disease prevention, like primordial prevention, primary prevention, secondary prevention, and tertiary prevention. You have to study more about this in a particular video, but in this video you have to just focus the review the syllabus of first semester BSc nursing. Okay. And then you have to study the healthcare service. In healthcare service, according to the condition of patient, if you have uh, normal complication of any disease, you have to go to the local clinics, not go to the AIMS. Okay. On the basis of condition, you have to go in different level of hospital. Like so first we asa bahu, like in PSC Sadar Hospital, you heard about this, na? And then you have to go to the PSC Primary Health Center, and then district hospital and civil hospital. Okay, so and state-wise hospital are there, and then national hospital like AIMS. So yeah, in this chapter you have to complete this kind of thing. Chapter will be the history of nursing and nursing as a profession. You are a nursing student, so you have to know about the history of nursing, right? When I started nursing, right? You have to study in a three phase, like ancient history of nursing, middle stage of nursing, modern stage of nursing, right? And then you have to study also development of nursing education in India, how you can develop the nursing, right? Fourth chapter will be the communication. Communication is an important exercise, especially for nursing. Communication build a relationship between nurses and patient. Nurses can talk effectively to identify the diagnosis of the patient, give better care of the patient, right? So sometimes patient will not talk to you. So you can observe the body language, facial expression. So you can identify which kind of care you have to need at right time, right place. Okay. So you have to study nicely communication, level of communication, types of communication like verbal and non-verbal communication, factor, barrier of communication. Okay. The chapter will be the vital signs. In vital signs, you have to cover the temperature, pulse rate, blood pressure, respiratory rate, SpO2 level, and one additional vital sign, that is pain. Pain assessment, like how to measure pain. There are different types of scale to measure the pain. We have to discuss especially in particular video. Okay. So sixth chapter will be the equipment and linen. I share a screenshot of some basic important equipment and linens. Okay. And then another chapter, that is seventh chapter will be the introduction to infection control in clinics. So in this chapter we have to study especially infection, why infection can occur in the hospital, which kind of mistaken taken by the healthcare provider as well as a patient, so cause infection more common in hospital. So one infection that occur in the hospital is known as a nosocomial infection or hospital acquired infection. So you have to study about that. And then chain of infection, how infection can occur in our body or patient. Okay, you have to study. And then we have to study about body mechanics, body defense, how to defense against infection, and immunity and immunization. Okay, one point is important in this chapter, that is biomedical waste management, how to manage waste. Like some waste are dry, some waste are wet, some waste are fluid or blood containing things. So some procedure are clean or some procedure are sterile. So you have to manage all the waste product in a proper manner. I have a four types of bag: red bag, yellow bag, blue bag, black bag. According to color, you have to decide the waste material you have to place where and where. These kinds of thing you have to study in a particular chapter. Okay, so you have to watch my video and please subscribe my YouTube channel so I can make a video on that and you can see and clear your concept. Okay, and the next chapter will be cover like, and the new chapter will be the comfort, rest, sleep and pain. In this chapter we have to study about comfort, how to provide comfort of the patient. Okay, there are a lots of comfort device we have to study in this chapter. They can provide comfort of the patient. And we have to study about rest, how to provide rest to the patient. Okay, and then we have to study about sleep, what is sleep, what is the purpose of sleep, why sleep is so important in our life, which kind of disorder related to sleep we have to study in this chapter. Okay, and then we have a pain already study in the vital sign more detailed. Okay, and then next chapter will be the hospital admission and discharge. When a patient come into the hospital, how to get admission and how to provide bed and other facility to the patient, and how to discharge. Okay, admission or discharge is a most important procedure to perform each and every patient, right? So you have to study about admission and discharge of the patient. Okay, and then we have to study new chapter like mobility and immobility. Sometime you break your joint, fracture, okay, and that time you have a unable to your range of motion of that particular organs or parts or joint. Okay, so that time you have to learn and teach the range of motion. You have to do that kind of specific exercise according to the body part. So in this chapter you have to study about body mechanics. If you are doing some basic procedure or work, how to hold the object and what is your position of body to hold this kind of things. Okay, so you have to study about your movement, body element in this chapter like mobility and immobility. Okay, and then we have a first aid. First aid is an important chapter you have to cover in first semester as well as second semester. First aid is an initial emergency treatment to prevent the complication of any severe kind of disease. Okay, so in the first aid we have to cover burn, like what is burn, types of burn, how to calculate burn, and in this burn condition how much fluid we have to given to the patient. This kinds of different law and calculation we have to study in this chapter. Okay, and first aid regarding burn, if patient is sudden burn, then how to do and what to do, so you have to learn in this chapter. Okay, and we have to study bleeding, what is bleeding, types of bleeding like external bleeding, internal bleeding, severe bleeding, other basis of the type of bleeding you have to study in this chapter. Okay, and first aid related to bleeding, if a patient having severe bleeding, so what to do, we have to study in this chapter. Okay, and then you have to study about shock. For example, if a patient having severe bleeding, so excessive loss of bleeding, we have a hypovolemic shock, like neurologic shock, or and different kinds of shock we have to study in this chapter. So what is shock, types of shock, and what to do in for a first aid for prevent the complication related to shock, we have to study in this chapter. Okay, and then we have to study the hemorrhage, excessive loss of blood, like. Okay, and then gangrene, and then we have to study convulsion, and we have to study about severe pain, and we have to study about like a lots of things we have to study in first aid. So then we have to study the snake bite, frog bite. If a patient bitten by the snake, then what to do? We have to study stepwise, okay? And then we have to study poison. If a patient poison are different types, okay, like gas valley poison and chemicals and some drugs and some liquid we have to intake and then get more danger. So uh, you want to finish your life, then you have to intake poison, right? In this condition, what to do to prevent from poisonous, okay? And then we have to study most important, most common life saving procedure, that is CPR, cardiopulmonary resuscitation. Okay, you have to study about CPR and step of CPR and which condition we have to given CPR. Okay, and then you have to study about bandaging, bandaging to prevent the uh, bleeding, okay, and lots of uses of bandaging, right? And then you have to study the choking. If uh, someone's in the airway, you have stick some substance, so he is unable to get breathing, right? So that kinds patient will be go into the unconscious, so you need to get to do CPR, that condition, okay? So how to prevent choking, okay? So choking you have to study in this chapter stepwise, okay? And then you have to study drowning, drowning, what to do, okay? So yeah, some these kinds of topic are covered in the first aid, and what to do, how to prevent these kinds of complication, okay? So this is the important topic to cover in the first semester BSc nursing, okay? I hope this video are good for you. I think all the topic we have to cover related to nursing foundation, okay? And then I make a lots of video related to anatomy, physiology, psychology, sociology, okay? So don't worry, if you have any doubt, please comment in my YouTube channel video, okay? I will be meet you in next video. So till that, have a nice day.